Okay, hello everyone. So thank you so much for being present with us. My name is Missy Gallegos, and Vanessa, can you go to the next slide, please? So the guest speakers today is myself, of course, the Health Education Coordinator for the National Center for Farmworker Health. And then we also have our guest speaker, Rosendo Iniguez, Project Director for the California Health Collaborative. We are giving him a little bit of extra time to arrive to today's webinar. He is a little delayed. So I'm going to dive into my slides and then I have a few slides in the beginning of our webinar and I have some information for you all at the end as well. So I'm just going to kind of have Vanessa kind of skip Rosendo's portion until he is able to jump on. So Vanessa, can you please proceed to the next slide? So our learning objectives that Rosendo and I are going to tag team today are understanding the importance of building community partnerships to strengthen tobacco cessation efforts, gain insights from a successful tobacco cessation program, including the strategies and collaborations that contributed to its success. And so Rosendo is going to be helping cover that program of his and just the strategies and tools that helped his program be successful. And then together, we're going to identify practical strategies and tools to identify, coordinate, and build strategic community partnerships to reduce tobacco-related challenges and provide comprehensive and quality care to patients. Next slide, please. So why is this important? Why is addressing tobacco use important among agricultural workers? And so I know many of you who may be familiar with our organization, National Center for Farm Worker Health, or maybe you're just learning about us today, but our mission is to improve the health of farm workers and their families. And I know some of you are here today because your mission aligns with ours as far as addressing the health issues of agricultural workers and their families. And one of these health issues is tobacco use among agricultural workers. We know it is an issue. We know that agricultural workers are vulnerable to tobacco use. In fact, recent data had showed that in 2022, 14,600 agricultural workers who visited a health center were identified as tobacco users. So we know that it is an issue. And that's why we're bringing this webinar to you to learn how to build those community partnerships so that we can work together to share resources, whether it's patient tools, whether it's screening tools, anything that has made your program successful in helping agricultural workers quit tobacco use. Another thing I wanted to share is when we're developing patient tools, really focusing on that smoking and how smoking and vaping can harm both the user and their individual, their family members around them. And so when we focus on resources that really tie in that smoking and vaping, the smoking and vaping health risks, we're really educating our agricultural workers and letting them know that it isn't the reasons why it's important to quit tobacco use, but not only that as an individual, but it's really important to focus as a whole community. So when we work with agricultural workers throughout the years that we've been working with this population, we have learned that the community-based approach is so much more successful than the individual approach. So if you're letting them know that if they were to quit tobacco use, that's gonna help you can say, su abuelita, sus niños, su esposa, o su esposo. So really that community, really making that change for their family and their friends or coworkers. And so why are agricultural workers vulnerable to tobacco use? Because the nature of their work. So many of you who work with agricultural workers are very familiar with how hard the working conditions can be for agricultural workers and how some agricultural workers are often moving around due to the nature of their work. Sometimes it can be traditional beliefs or customs. We had done a really neat focus group with agricultural workers. It was a group of smokers and non-smokers. And the smokers stated that in Mexico, for example, it's really the tradition there is just kind of smoking is available everywhere. And compared to, the US, it's kind of seen more like it's okay. You can smoke a cigarette to help you relax. So kind of among the family That's what some of the information that was shared with us. And so, what are some of those reasons that agricultural workers are using tobacco to help with stress and anxiety? We had, through the focus group, we reported some agricultural workers stating that it's mental health related. As a maybe it's because it's a habit. We had one agricultural worker share that they do it because it helps them gain energy to be able to continue working. Maybe social situations. So if maybe they don't smoke at home, but maybe they come to work and they smoke at work. And again, that nicotine addiction piece. So we all understand that nicotine is extremely addictive. More than 70% of the general population, according to CDC, who are smokers, want to quit smoking, but it is extremely hard. So remembering that together as a community, as organizations working together, we can partner to address the tobacco issue among agricultural workers because evidence does show that when they're receiving that healthcare professional support and evidence-based resources to help quit tobacco use, that increases their likelihood of quitting tobacco. And so moving on to the next slide. Vanessa, can you progress to the next slide, please? So again, we're here about to discuss partnerships to help increase your reach, share resources, and collaboratively support education and efforts to reduce tobacco use among agricultural workers. And I know Rosendo is here with us already. So I am going to transition it over to Rosendo. Rosendo is going to be sharing his program. And again, as he's diving into his program, he's going to share not only the successes and the tools and strategies that they used, to address tobacco use in his community, but also the partnerships that help make his program successful. So Rosenda, I see that there's camera issues kind of bouncing around, but you're here, so that's good.
Yes, I'm here. Hello, everyone. Rosendo Iniguez. I am the project director for Latino Coordinating Center for Tobacco-Free California. We are a nonprofit organization out of the state of California, funded through the California Department of Public Health, specifically through the California Tobacco Prevention Branch. We are a program of the California Health Collaborative, which is a statewide nonprofit organization in partnership with the University of Southern California. And so, as Missy shared, my goal here during our time today is just to share some of the work that we're doing in California, the importance of partnership to really ensure that we're able to assist our community, specifically our Spanish-speaking community, as well as our agricultural workers. And so I want to see if we can get these slides up so we can go ahead and share some of the information, and hopefully the information that we share is hopefully useful, that can be replicated throughout the country, and of course, share some of our best practices. And so again, my name is Rosendo Iniguez, so we can transition the slides to the next one. So really our goal is to improve the overall health of everybody in California. Of course, we do emphasize, as our name says in our program, with the Spanish-speaking community. So really our goal is to work with other programs throughout the California to implement policy change to help these communities. Next slide. And so we have identified several priorities throughout the duration of our program. The four of which we have listed here on our screen, which is to prevent youth initiation of tobacco use, to prevent the exposure to secondhand smoke and aerosols, and to promote tobacco cessation, as well as to build community capacity and leadership. And so really what we'll talk about today is what we have learned so far in regards to promoting tobacco cessation, to helping people who want to quit using tobacco, to ensure that they have the resources necessary. And of course, an important tool, an important step to that is developing partnerships. Next slide, please. And so I want to just go ahead and share a little more about the importance of cessation and really treatment, of course, because when we're talking about tobacco cessation, we know, of course, it's an addiction. Nicotine is a very addictive substance. And so for anyone, of course, is a big challenge to quit using tobacco, but even more for our priority population, specifically our Spanish-speaking community. Next slide. And so one of the things that we really want to emphasize is the importance of encouraging tobacco users, people who smoke tobacco or eat tobacco product, to quit as much as possible. What we see oftentimes is there's certain groups, certain party populations that oftentimes maybe perhaps aren't necessarily referred to medical treatment or cessation services by the medical providers. And so first and foremost, we want to encourage all of you, regardless of which sector you work in, whether you work with farm workers, where you work in a clinical setting, CBO, to really try to ensure that we encourage this community to try to quit as much as possible. Next slide. And so remembering as well that there are several ways to quit smoking, right? There's several cessation and treatment options, and many of which we want to make sure that we always keep in mind, some of which might work more effectively for others, right? We probably know people who are able to quit, as we call cold turkey, but some need additional assistance, some need additional help. And so remembering that there's different types of nicotine replacement therapy, different forms of treatment, some of which may be individual, group, as well as telephone counseling. Next slide, please. And so when we work with these party populations who speak Spanish, of course, we know that they particularly have these specific challenges because there might be certain habits that makes it a little more or less likely for them to seek treatment. There are certain community members that perhaps have a little more challenges communicating with their medical care providers. And so, of course, as a language barrier, might serve as a challenge and might make it difficult for people to join or people to receive cessation services. Next slide, please. And so one of the things that we do here in California, as many states have, they have a quit line. Here in California, we have Kick It California, which is also funded through the California Department of Public Health, California Tobacco Prevention Program. Kick It California, we'll go to the next slide, is a completely free service that is available for people who want to quit using tobacco. And so it's available in different languages, including in Spanish, and it's proven to help people with quitting, as well as to just really provide services. And so people can call this, whether it be they access it through the website or access it through the phone, so that way they can then receive the services. One of the great things about the Kick California is that they're also very mindful in regards to what personal information is asked of the participants who call in. And so we know, of course, there's certain information that people might feel a little uncomfortable sharing, such as address, or some programs might be concerned of asking things such as social security numbers. And so Key California does not ask those questions that can be a little intimidating for participants to provide. So again, with the Kid California, they provide help through text, through phone, and again, available in multiple languages, including Spanish. And so here in California, one of the things that we try to do, especially with our program, is to try to funnel as many people through Kid California. And so we highly encourage, if your state, if your community already has a free service such as Kick It, maybe might have obviously have a different name in your respective communities, is how can we get more people to go through this program or go through and receive these services? Because of course, with cessation, it can be very challenging, very difficult, or there might not be as many resources available at the local level. And so, how can we also get more programs? And so, one of the things that we have done here in California, and we can transition to the next slide, is we use the Ask Advisor for model. And so with this, we work with different programs, or we've had communities throughout California that work with community-based organizations to really have staff. Again, they don't have to be medical providers, but they can utilize the Ask Advisor Refer to identify if a person is using tobacco, and then to identify if there's an intention to want to quit. And if so, they simply provide them with the information for California. And so again, they have a referral process. Again, it makes it easier for all communities, especially our Spanish-speaking population, to receive and access services. And so again, just want to emphasize the importance of highlighting and referring individuals to these services that are already available, and especially available in different languages. Next slide. And we can just transition to the rest of the information on the slide here again. So this is what I was referring to with the Ask Advisor for. We can go back one, thank you. So there are actually, I know there's several programs that are somewhat similar to this system, the systematic approach. Again, as you can see, is ask every person if they smoke or use tobacco. And again, really anyone with the proper training can utilize this. It doesn't necessarily have to be a medical provider. Perhaps you might work at a fairly qualified health center, or you might work for a community-based organization, or maybe even a school setting, right? So regardless of what setting we work in, this is a really simple approach that help get more people to access the services available in each of our communities. So the first step is to ask every person if they smoke or use other tobacco products. Of course, this refers to also vaping products. And I also want to emphasize as well that when we talk about tobacco, we're referring to commercial tobacco. We're not referring to some of the tobacco that might be used for cultural practices, for religious purposes. So we're referring specifically to commercial tobacco that is sold for recreational use. So after you ask every person if they use tobacco, you advise those who do want to quit. And that's very important as well because we might have members of the community that they know that obviously they use tobacco and they know it's not the best for them. They know it's not something that they should be doing. However, they might not necessarily be ready to quit. Nonetheless, it's still great to provide them with this resource, whatever resource you have available in your community, because you never know when might be the time. And so if they know who to call, it would make the referral process or would make the cessation process one step much more quicker. So we ask every person, we advise those who want to quit, and then we refer them, right? So if they say that they want to quit, they're considering quitting, then we refer them to Kid California for coaching. So again, I want to recognize and give a shout out to Kid California, but also again encourage you and your respective communities, whichever state you might reside in, to see what services are available in Spanish and different languages, so that you can create a referral process to get more people to go into these services. Next slide, please. So again, for those that are interested, maybe perhaps live in California or know family members who reside in California, here is the information. I believe also in the chat box, the website, the link was also provided. So I highly encourage all of you to take a look to see what resources and what information is available. One of the things that we'll also share is our program, the Latino Coordinating Center. We have partnered with Kid California on multiple occasions to help create educational materials in Spanish that are appropriate for Spanish-speaking community. Because of course we can simply put Spanish, we can translate on a website, Google Translate. It may not always be understandable. So again, working with specific programs in the community such as ours that work with the Spanish-speaking community is a great recommendation to ensure that any educational material, any communication made with the community is understood. Next slide, please. And so I believe in the chat box, we'll go ahead and post a link as well. We had created, along with one of our partners in the Bay Area, this document, this handout, which is a great recommendation or a great tool, I should say, for those that want to utilize the Ask a Refer process, specifically with our priority populations, again, which of course can be applied outside of California. So the link will be provided, and we highly encourage all of you to take a look at this information that hopefully can be a great resource. And of course, at any time, if you have any questions on how you utilize the recommendations provided, or really in regards to our program, you can also or you can also reach out to myself via email. We'll provide that contact information at the end of my slides. Next slide, please. So in addition to getting more people to California, one of the things that we also have found within our state is the importance of working with different programs to increase screening and treatment with the existing care systems. Next slide. And so one of the things that we have seen, have learned in California is the importance of working with our Medi-Cal populations, which of course Medi-Cal outside of California will be also known as Medicare recipients. And so we have program, for example, California Quits here in California works with different organizations, healthcare plans, to ensure that these healthcare plans and their partner and the networks are ensuring that they are doing proactive outreach to the community so that way they can get more people into these referral systems. And so one thing I want to highlight, if we can go to the next slide, is one of the things that they are doing. So of course, if there's similar programs throughout the country, one of the things that California Quits found is the importance of proactive outreach. Because again, as we mentioned earlier, many medical care providers did not really refer their patients to the appropriate medical services. And so instead of putting all the responsibility on medical care providers to do the referral process, in this case, California Quids, in partnership with these healthcare plans, identified who within their members, right, which patients, who in this case are Medi-Cal recipients, were also tobacco users. And instead of reaching out to them, informing them of the different cessation services that exist in California, many of which provide free nicotine replacement therapy toolkits, as well as education. And so again, instead of expecting the patients to come to us, or instead of patients to come to their medical care providers to then receive cessation services, is the other way around. Is how can then we do this outreach for the community and let them know what is available? Because what we oftentimes see within the Spanish speaking community is that they might not necessarily be aware of what services are available. And so therefore they oftentimes go without seeking services. And so again, very important for all programs, healthcare plans, and organizations to ensure that they do a proactive outreach into the community to let them know what services are available. Next slide, please. If we can transition the rest of the information onto the slide, please. So when we engage with healthcare systems, we want to make sure that we leverage existing relationships. And so whether we are creating new relationships or um, whether we're creating new relationships or trying to start new, we want to make sure that we are making that a priority. Again, as earlier mentioned, partnerships are really key to ensuring that we're providing cessation services to our community. It is very difficult for one program alone to be able to provide enough outreach to the population, especially for our Spanish speaking and for our farm workers. And so when we have a relationship, every partner, every organization provides something, has something to contribute, whether it be access to patients, whether it be the cessation services themselves. And so again, trying to leverage these existing relationships. And then oftentimes what we see, especially, and this is one of the things that we've noticed recently, is we oftentimes work within our own silos, right? For example, here in California, we oftentimes tobacco control programs only work with tobacco control programs. But instead, we encourage, and I encourage all of you, as we are doing, to try to work with other partners or other organizations working in other areas. For example, in chronic disease management, in housing, those working in immigration, right, to see how we might have shared goals. And in many cases, we ultimately have the same goal of improving health among the community, but we're simply approaching it in a different way. And so, for example, if we were to partner with organizations providing care regarding, let's say, chronic disease, diabetes, certain types of cancer, of course, their goal is to help the patients control their chronic disease or to manage or to treat it. And so, if we were to then work with them, leverage these relationships, and address the issue of tobacco, of course, we know that can also play an important role in improving their healthcare, improving their diabetes, minimizing the risk of certain cancers. And so, of course, that is very important. So, when working together to create these relationships, you want to make sure that you convene the appropriate stakeholders, identify those in leadership that should be at the table, whether it be the CEO or again those in leadership roles. But oftentimes as well, it may not necessarily be the leadership that is involved. It might be other individuals that might be the one providing the one-to-one services in the community. So whether they be program staff, even promotoras de salud, oftentimes are a very important role in these organizations. So again, really want to highlight the importance of engaging health systems, however they might exist in your respective state. Next slide, please. And so, if we can go ahead and transition the rest of there, thank you. So, when we do in any efforts that we do for cessation, of course, there's an importance for screening as well as counseling. And so, just all in all, cessation, of course, is a big task, right? We're dealing with an addiction here, and I don't want to for us to forget that, right? Of course, we're trying to help someone whose body has adapted to nicotine. And so with that, we want to ensure that we are also screening, but also counseling. That's why we oftentimes say cessation as well as treatment, because that counseling process is kind of an ongoing thing, right? It's not necessarily that they just take a class, they quit smoking, and that's it. But how can we also ensure that we are able to then help them manage through counseling to ensure that they stay, that they don't necessarily fall back to nicotine. And so, of course, with this, we want to make sure that we seek opportunities for natural alignment. And I see in the chat box, many of our program staff is sharing an explanation of some of these acronyms that you see here. And I'll go ahead and also just elaborate on that. In California, we have what we call local lead agencies, LLAs, and many of which are our local public health departments, for the exception of three different counties that are the local lead agencies is actually the California Health Collaborative. And so, again, working with our local public health departments or our local agencies that may already have in their scope of work a referral process, whether it be ask advisor refer or a completely different policy or a completely different approach. And by doing so, right, by working with these programs that already have in their scope of work to have cessation services, we can then help to facilitate more referrals to programs such as Kid California in California, or of course, any association services that might exist in your respective communities. And then also identify if improving tobacco measures is a priority or not. Unfortunately, and again, this varies from community to community, there might be other pressing issues. There might be other concerns, other health issues that might hold higher priority, whether it be mental health, whether it be other chronic diseases, infectious diseases. And so, again, identifying where does tobacco fall in regards to the level of priority. And of course, obviously, we work in tobacco control, so we would obviously advocate for pushing tobacco higher on the priority list because we know its relationship with other health issues, right? We know how decreasing tobacco use can also improve other health outcomes, increase life expectancy, and of course, reduce the risk of other chronic diseases. And so, as much as possible in your respective communities, we want to ensure that we push for tobacco as being a high priority. I think we have oftentimes think that tobacco is no longer a problem because we don't see as much of your traditional tobacco products like cigarettes and cigars. But now we see vaping products, we see these electronic smoking devices, and there's new products that are going to hit the market pretty soon. And so let's not forget that tobacco is still an issue that's harming our Spanish-speaking community. It is still an issue that's affecting our party populations. And so, as much as possible, let's try to ensure that is a high priority in our respective communities. And of course, this might apply to some of our federally qualified health centers, medical care plans that are on the call, but also explore to see if there's any requirements to receive payments. Some locations, some states now are able to provide funding or reimbursement for cessation services or for referral. And so, seeing what funding is available and of course, this might assist with the sustainability, right? The sustainability of a program if there is a reimbursement or a payment process available. Next slide, please. So some of the lessons learned again, and I really want to really highlight California Quits and the work that they're doing. California Quits is a program also funded through our California Tobacco Prevention Program or California Tobacco Prevention Branch. Through CDPH, California Department of Public Health, and they are operated through the University of California, Davis. In fact, Dr. Cindy Valencia is one of our advisory committee members and also played a vital role in some of this information that we're providing to you today. And so when you are working with your respective communities, right, it's important that we have key facilitators and so identifying who is funded and what funding is available to provide these services. Again, we kind of previously mentioned what are the priorities of the community. And so by identifying these funding sources, by identifying what funding is available, again, it just helps for the sustainability process to ensure these programs are well funded, that are well staffed, to then provide better support to the community. And one of the things also that's very important is the leadership buy-in. Is really ensuring that whatever program they're working with, whether it be a healthcare center, a CBO, a school system, a university, that the leadership really buys into what we are doing, and it makes work much more easier. So in your respective community, you probably know who are those that really make the decisions, and it might be elected officials as well in this case. And so, how can we create the buy-in? And so, you as an organization, you as a professional public health, we should really try to work with and create this relationship with leadership so that way they can support our efforts and really also serve as what we see as next bullet point champions. They are advocating for the work that we're doing. And again, I mentioned elected officials, and of course, they can be very important champions. But at the same time, we cannot forget the champions in our community, right? Just community members, our Spanish-speaking folks, promotores de salud, or community health workers. Many of them can serve as champions. So really champions, and again, really just a different term for this is advocates, leaders, respected leaders that are trusted in our community, that can share and promote a specific program, and others will also follow. And so that is very important that we have these members in the community that can serve as champions for the work that we're doing in cessation. Also, staff capacity. Now, of course, this and there's a lot that goes into staff capacity, but for those especially that have a leadership role, have program staff, really ensuring that your staff are able to work with Spanish-speaking community members. And it doesn't necessarily mean that they themselves have to speak Spanish fluently, that they have to be of a certain race or ethnicity, but simply have the ability to work with different cultures, work with different groups, and understand their respective beliefs or their respective perspectives to ensure that any information that we provide them really aligns with their values. And so, again, the importance of staff capacity, make sure that our staff are participating in different trainings. And at the same time, too, of course, with especially we're seeing here in California, the tobacco funds are also somewhat becoming, they're running out, right? Some of our programs are tax funded. So as people buy less tobacco, less money comes in. And so some programs might not be as fully staffed. Some programs might only be one to two program staff. And again, that really speaks to the importance of then creating partnerships. If you yourself or your organization can't necessarily fully provide the service, then let's work with those programs. Let's create those partnerships. And it's kind of as we mentioned earlier, who are providing those services and how can we then create those partnerships as well? In doing so, we want to make sure we create simple workflow. And again, with cessation with tobacco can be very complex, right? When we think about why people use tobacco in the first place, there's more than one reason. And so rather than focusing on all these different reasons, or especially with cessation, let's just create really a simple workflow that works for the community, that doesn't make things a little more complex and makes it more simple so that way we can then have a proper referral system. And lastly is always identifying trainings or providing trainings to program staff and really to the community so that way as a community they know what services are available. But at the same time, for example, we can then have people trained on Ask the Right Refer or any referral process. So again, so we don't necessarily need a medical care provider to refer people to cessation services. But again, we have members of the community, champions, or your respective organizations being able to bring people to the cessation services. Next slide, please. And then if we can then put the remaining information on the slides. So, of course, with everything comes challenges. We don't want to make this sound like it is a walk in the park. There are always going to be challenges. Again, as I mentioned, cessation itself is a challenge. Now, also getting people to cessation services also poses a challenge. One of the things that we notice here in our respective communities throughout California is there oftentimes might be difficulties with getting people to attend or to participate in cessation services. And again, this really refers to both in person, but also sources over the phone or via telecommunications. And so, how can we also provide, or one of the things that we have done to get people to participate in cessation services is provide some type of incentive for the individual for participating. Now, in many cases, this could be nicotine replacement therapy, right? Free nicotine patches, but it can also be gift cards. It can also be other ways to incentivize and reward the individual for participating in cessation services. And one thing as well that I just want to quickly just share is for those that do complete the cessation program to recognize them, to celebrate them. One of the things that Spanish-speaking folks really love to do is to celebrate, especially a important milestone as is quitting tobacco. And so, for any successful milestone that each person reaches in their journey to quit tobacco, recognize them, recognize the program, and so that way they can also celebrate and increase morale to encourage them to continue working to staying nicotine free. Again, making sure that we align goals with existing ones. We know that many of our programs have different scopes of work, different objectives, and so sometimes it is difficult to provide them with additional responsibilities. And so, how can we align our goals with those that already exist so that way we kind of streamline the services moving forward? Again, review and address workflow gaps, as well as engage staff impacted by changes, especially those that are going to be implementing the programs. So that way they know the expectations and they can also prepare for that. Next slide, please. And so, just quickly to wrap up on that specific conversation of provider services, again, we encourage, especially if we have anybody that works in fairly qualified health centers, works with patients, work in the medical setting, that we always encourage our patients, especially those that we know that identify as tobacco users, that we are referring them to cessation services in their respective communities. And so again, especially even if they have a chronic disease, because again, we know the relationship between tobacco use and things such as heart disease and diabetes. And so it's very important that as a provider and as people working in a medical setting, that we encourage people to reach out to or to we refer them to cessation services. Next slide. And so with that, I'll go ahead and pass it on to Missy, who will continue on with our webinar.
Yes, thank you so much, Rosendo. Thank you, everybody. We were seeing as Rosendo was sharing his information, I saw some just information being shared and questions coming through. So thank you so much. And when we get to the Q&A portion, we'll definitely help cover some questions that you may all have. But Rosendo, thank you again. The information was just key and valid to today's webinar. And so I'm going to wrap up the next with the next couple of slides, just talking about collaboration. And really for this slide, I'm going to share a bird's eye view, especially with the types of collaboration that exists, because I feel that many individuals are already familiar with these types of collaborations. But we have coalitions and task force partnerships and then referral networks. I know Rosendo talked about some of that referral those referral opportunities to refer into the state tobacco quit line and really using those to your advantage. And also really the direction that you go as far as a collaboration, it's really going to depend on your goal and the objectives of what you're trying to obtain within your organization and within the program and the community that you serve. Next slide, please. And so for this slide, I am going to dive into each one of these just a little bit deeper. I'm going to use some examples from my previous employer. I did tobacco prevention and cessation work in Muskegon County, Michigan. I was part of the Muskegon County Health Department for about 10 years, and I was part of the county coalition and the state coalition. And the county coalition there in Muskegon, it was such an amazing collaboration and coalition that came together. We had law enforcement, we had county commissioners, we had principals from pretty much every school in Muskegon County. We had treatment facilities, mental health facilities, just you name it, like FQHC centers, hospitals. Everybody was on board trying to tackle reducing tobacco use among youth and adults. And so coalitions it's an organization where people are coming together, just some of those agencies that I shared, all working towards one common goal, really to have that community-based approach to make an impact via community-wide. And at times they're also perhaps working on creating smoke-free environments and really just tackling that tobacco prevention and helping people quit. And so just to give you an example of how well the coalition that I worked for in Muskegon County, Michigan, we were nominated out of 5,000 coalitions. We were nominated top coalition and got the Got Outcomes Award from CADCA for reducing our tobacco youth rates in our county by, I believe it was slightly more than 50%. So we got to travel to Washington, D.C. We got an awesome award. We went upstage and in front of a bunch of people. It was just a really great experience. And so just to show that coalitions do work and they do really help allow you to make that community impact. And so if you're not part of a coalition, definitely I would encourage you to at least, if you don't have local coalitions, at least maybe to connect to your state coalition. And nowadays, with everything being virtual, it's so much easier to attend meetings. And then you have your partnerships. So partnerships, again, is two or more organizations that really complement each other's goals. You're increasing access to tobacco cessation and tobacco prevention resources for the priority population that you're serving. And so another example of my work, of my previous work, we had applied, the health department in Muskegon had applied for a grant to support a local hospital who was, it was a a pathways program. And they had multiple pathways. So some of them were chronic health conditions, and then they had their tobacco pathway. And so the individuals that were running these pathways and working with patients that were under that fell under these pathways were community health workers. And so a lot of the community health workers were saying that they were struggling getting their patients to complete the tobacco pathway. They were completing all the other pathways, but the tobacco pathway, of course, that was one of the difficult ones that they couldn't get their patients to complete. So we had done a survey and we learned that they didn't have access to screening tools and resources that they really needed to help build up that tobacco pathways program. So the grant was denied. I ended up partnering with a local agency in the community. Um, the gal that was assigned to that activity, her and I, we ended up doing an initial survey again, learned what they were in need of. And then a year later, we did that same survey again, and we found out after we put together a robust training program for them, which included motivational interviewing, stages of change, ask, advise, refer, like Rosendo had referred to, the 5 A's as well. And a year later, we learned that we increased their resources and the tools and strategies that they had access to by 70%. And then after 3 years of walking through them through those trainings, we did an assessment to see if their patients were now successfully completing the pathway program, and they were. So it wasn't by much, but we did see an increase in patients completing the pathway program for tobacco. And so we were really excited about that. And again, it goes to show that partnerships are key and partnerships can work. And then so referral networks, I think Rosendo did a great job at talking about referrals, and that's really what I wanted to share was making sure that you connect with your state tobacco quit line. Each state has an individual, like a contact person that could provide training so that they can teach you how to use the referral form. I know the state of Texas does. And when I was in the state of Michigan, we also had training on how to use that form. And we would refer our pregnant moms in the WIC program there at the Muskegon County Health Department to the Michigan State Tobacco Quit line. But thank you again for listening on the types of collaboration. And then Vanessa, you can go to the next slide, please. And then just a brief, I'm going to dive into these briefly, but these are just some additional partnerships. So you can partner with someone who has a mobile unit. So for example, in Muskegon County, we partnered with a mobile unit that offered carbon monoxide testing. And so when smokers would get their carbon monoxide level tested and it would come out high, at that point, we had their full attention. They were ready to listen to the information we had and accept the resources that we had to offer. And then we would refer them to the state tobacco quit line. And then we have, you can do education and training programs. So here at NCFH, we have tons of resources, not just in tobacco, but other areas regarding health to educate agricultural workers that you can use in the community. We do have some new tobacco cessation tools that you can use as well. And I will be sharing those later, but you can do what we call like a tailgate session or a charla where you can have, you're presenting to a group of agricultural workers on the farm or on the field, which I'm sure many of you already do this. But I think I want to take this webinar and have the opportunity during the Q&A for us to share each other's resources, because if your agency has developed patient tools for agricultural workers on assisting them in quitting tobacco, it would be great if you could share them today so that we can all just cross promote and share our resources. And then another helpful tool that you could do is partner with agricultural worker employers if you don't already, and also local agricultural worker champions. And like Rosendo said, community health workers or promotores, because a lot of times the promotores are from the community that you're serving, right? So kind of gathering that champion, because if you're hosting that tailgate session, educational session, or maybe you're doing a social media campaign where you're using Facebook or Instagram, or maybe you're using WhatsApp. And so you can use the support from your champions to kind of funnel agricultural workers into those channels or platforms that you're using. Next slide, Vanessa. So again, partnerships are key. We talked a little bit about the different types of collaborations that you guys can tap into or become a part of or take advantage of if you're already a part of them. And it's going to, again, just help broaden that opportunity to increase access to services for special or vulnerable populations like agricultural workers. And it's really going to allow a more integrated approach to identifying and tackling barriers to health-related needs. Next slide, please. And so when it comes to collaborative relationships, we know that it is a two-way street. I mentioned some great examples of the work that I did in my previous position addressing tobacco prevention and cessation. And so through through the partnerships, through the collaborations and coalition work that I did back then, that really helped us save time and money and resources with staff. It allowed us to improve our cause and our goal and get it out there, and then really expand our reach. And so here at NCFH, we've also seen that happen. We work with about 174 health centers nationwide. We're all working towards the same common goal to serve agricultural workers. So, where it's been a two-way street for us for many, many, many years. And so these webinars are really just an added bonus to allow us to really build up on those partnerships and give us an opportunity to share resources. Next slide, please. And so community asset mapping. Vanessa's going to pop in a link. It's going to be a link to Google Maps. And if you're wondering, why do I need a Google Maps link? What does this mean to me? So really, this Google Map, you can take advantage and develop what we call here at NCFH a community asset map. So what I mean by asset map is many organizations already have a list of resources to address health-related needs. So for example, maybe a list of agencies that offer housing. Maybe there's a huge list on agencies that offer food services, dental services, maybe support with vision. Maybe there's agricultural workers that need glasses. And so you have this amazing list already made up for your patients that you serve. And so what a community asset map is that you can go a step further and take your list of resources, whether you have it already built in Word or you have it built in in like Excel. You can take that information and plug it into Google Maps and actually create a really nice, robust map, which is what we call a community asset map. And Vanessa just popped the link into the chat, but I'll give you a chance to click on that link, but you'll see it'll take you right to, it'll say create a map or open a map. And it does walk you through on how to uh, develop a map and plug in resources. But myself and my coworker, we are both, his name is Mario. He works for our communications team, but we're willing to provide technical assistance for anyone that wants to actually take advantage and take their resources and then plug them into a map. And so, Vanessa, next slide, please. So what I mean, once you develop this map, you're going to have access to a Google map that's going to bring you to your resources that might address emergency services, local and state government agencies, healthcare, so mental health facilities, for example, elderly care facilities, also social organizations that support a community's traditions and beliefs. So maybe some faith-based organizations as well as educational organizations and neighborhood resources. Next slide, Vanessa, please. And so Vanessa's going to drop another link in the chat. And so I've been talking about this asset map. And so this is what your asset map would look like if you chose to take your agency resources or your collaborative partner resources that you have available. So when you're referring patients, you already have this list, right? But now you can take that step further and plug them into this Google map and create your asset map. So now you have a nice, robust map with the assets to address the health needs in your community. And if you click on the link, it is, when our coworker created it, it really was more just like an example to show the community what it could look like. But what he did is he took Austin community's resources regarding food service, religious organizations, housing, some medical and community resources, and he put them all into one map. And so when you click on an icon, some of them might not have it, but most do. It'll tell you the name of the agency, the address, and the contact number. So it could be a really great tool for you to cross promote your asset map with other organizations. You can have it available when you're doing outreach. You might have your phone and you can access the map when you're out doing outreach and there's a question regarding any of these services. It's also a great tool that you can share with agricultural worker employers. So they can have access to this tool. I know there's a lot of agricultural worker employers out there that do want to share resources with their employees. And so if they had something like this, that would be a really great asset for them. And you can also choose to decide how you want to build your map. It doesn't have to be all compiled. You can create one map where it's just all medical. You can create another map where it's just maybe all housing, and then another map where it's just all food resources. And so then you can share each individual map depending on what your agency partner is asking for, what you might want to cross share. And then maybe as you've shared your map, both agencies or multiple agencies or as a coalition, you can plug resources into this common Google map where everyone has access to, and you can just keep building it and building it. Next slide, Vanessa, please. And so Rosendo has done a great job at presenting a lot about his tools and strategies and just how to kind of use partnerships to build some of the, your approaches to address tobacco use in your community. And I shared some information. At this time, I really kind of just want to gauge where everyone is at and give you the opportunity to answer in the chat how partnerships have supported the population that you served as far as addressing their needs when it comes to struggling with tobacco use. You don't, it doesn't have to be an agricultural worker community. It could be any population that you serve. It's really if you want to just share how partnerships have supported you, and anything that would be helpful for everyone else to know. And I can keep an eye on the chat for any responses that might come through. Does anybody have a successful story of a partnership or collaboration that really supported you in helping address tobacco use among your community?
And Missy, maybe perhaps while maybe was thinking about a question, I know one of the questions that we oftentimes um, receive, or not necessarily just us, but our people that we partner with is really exactly that. Like, how do you create or how do you establish these partnerships? Considering that oftentimes many programs have different priorities or different activities or scope of work activities, and so one of the things as well that we just want to also just emphasize is the importance that again we can't really do it alone, especially with our farm worker, our agricultural workers. They oftentimes face multiple challenges, and so just trying to find those different programs that have a common goal of assisting the health of the individuals that we serve. Again, it might be outside of the work that we do, right? Different realm. As I mentioned, we work in tobacco, but we oftentimes will have to work with people that work in housing or asthma or other chronic conditions. So really encourage all of us to think outside the box, to bring people to the table, to the group that needs to be there to ensure that we are then able to provide the best assistance to these organizations. And also just want to also thank you for the asset map and that example, because sometimes we don't know what organizations exist in our communities. So if we can provide this to our partners, or really the community that we serve, they know who to call, they know who to contact, for these different programs. And so, thank you for sharing that.
Absolutely, yeah. And great point, Rosendo. Just really, like you said, thinking outside of the box. As far as other organization and partners that support you that you've worked with along the way. Like you said, like housing, because I mean, if they're worried about housing, the likelihood of them wanting to quit tobacco use is going to be difficult and it's going to be challenging. So it's really addressing those other health related needs to be able to kind of really assist the individual as a whole in every aspect when it comes to quitting tobacco. But we did get some few answers in the chat. We have community health facilities and multi-unit housing managers. So thank you, Shirley, for dropping those in the chat. And if there's no one else or there's no other responses in the chat, we can move on to the next slide. Next, I'm going to be sharing a couple of resources. And so as NCFH, we do create resources often, not just on tobacco, on other health-related issues. We recently have been developing a lot of resources surrounding H5N1, specifically for agricultural workers and what to look for. And so, again, we are here to provide support for everyone in the community, our partners nationwide who are working with agricultural workers. And so we did develop not too long ago a tool called a guide for health centers to address tobacco use among agricultural workers. This guide is currently being updated. So I unfortunately do not have access to share it at this time, but it will be available soon. So what I am going to be doing is just sharing what you can find in this guide. And even though it says that the guide is for health centers, it's for any organization and community-based partner who serves agricultural workers. Vanessa, next slide, please. And so in the guide, it's going to guide organizations serving agricultural workers by defining tobacco and the different tobacco products Through one of the focus groups that we conducted here at NCFH, we learned that among tobacco users, among the agricultural workers that were using tobacco, it seemed like cigarettes were really the more common product being used. Very few said they vaped. They kind of felt that they perceived that it was more common among the younger population, but not really so much the adult agricultural worker population. And so we do share some of that information in this guide. We also share some really neat, we kind of plugged in some features of the focus group into that guide as well. So you can gauge and get an idea of the thought process and of our agricultural workers that we did the focus group with. And then we also share why agricultural workers are more vulnerable to tobacco use. So very similar to how I opened up today's webinar. And then the benefits of quitting tobacco use for agricultural workers. And then, of course, screening tools and strategies to address tobacco use, as well as the quit lines and a couple of links that are available there. But the screening tools that we have in this resource are great. There's probably about 5 or 6 of them. One of them is one of the resources that Rosendo shared, the AAR. And so ask, advise, refer. And so studies show that even if you just do a 3-minute brief intervention and you take that AAR, that is so much better. If you don't have like a whole, 30 minutes or 15 minutes, just literally a 3-minute intervention with that AAR is so crucial to helping anyone in your community quit. And so you'll find all those great tools when I am able to finally share that with you all again. And when it is ready, I'll send that to you via email. But next slide, please. And so here's just a list that you're going to find in the guide for organizations serving agricultural workers, as well as a patient tool. So we did kind of like a two for one, which was the guide for organizations, and then a patient tool that organizations can use during outreach. And both the guide and the patient tool have this information in them, which cover the benefits of quitting for tobacco use for agricultural workers. And some of these include saving money, less days of feeling sick, and possibly less days of missing work. Many of you who work with agricultural workers know that, sick days are not really the most common. And so, it's really important to stay healthy for agricultural workers to not miss days of work. We talk about the less risk for cancer, stroke, heart, and breathing problems. When we conducted the focus group, we learned among the smokers, the group that were smokers, that they reported problems with breathing. And when they were out working, that they didn't feel the energy and they had more coughing. And so we have firsthand information of agricultural workers that can attest to not just how tobacco affects the general population, but how it has impacted them as well. And so again, less shortness of breath when doing daily activities. And then less risk of secondhand smoke for people around them. And so again, if they quit smoking, these are some of the benefits that they can see: the less coughing, the less risk of breathing problems, less shortness of breath, and just making it easier to work in the fields. And so if you can move over to the next slide, please. And then Vanessa's going to drop the link for this resource. So this is our patient tool that I mentioned. It is a really great tool. It's actually a door hanger. It's double-sided. It's in English and in Spanish. You can see like the little dotted lines there, or the dashes. You just cut around there and then just pop it on the doorknob when you're doing outreach. And it's just a great way to leave your information, especially if they don't answer the door or if they're not available and you're in the housing communities and you want to leave this information. But it does address what tobacco is. It really has more like of a positive approach. It shares common tobacco products. And again, it's both in English and in Spanish, and it does have the reasons of why they would benefit from quitting tobacco. And so if you can move on to, and if anybody needs technical assistance for this tool, I would be more than happy to answer any questions regarding this tool as well. But when the guide is ready, they pair each other up so nicely because the guide is pretty much like prepping you and kind of giving you that background education and information. And that tool is coupled with that guide. So it's kind of like a mirror, but of course the tool for agricultural workers is simple, it's simplified, it's relevant and straight to the point. Um, Vanessa, if you can please move forward to the next slide. And so we do have a very new resource coming very, very soon. It is still in review, but it's pretty much already done. The design is complete. We're just getting approval so that we can start actually sharing the link for it. But it is going to be in English and in Spanish. And my coworkers did create this tool. Vanessa, if you can go to the next slide, please. And so the tool is called Path to Quitting Tobacco. What does yours look like? So I collaborated with a couple of coworkers of mine. They led the project, but we kind of put some ideas together and we wanted to create a tool that would address the stages of change for agricultural workers. So this is a patient tool and it's actually really, really neat. So it's gonna walk an agricultural worker through each stage of change to give them a visual idea of where they're at. So, if they're in pre-contemplation, what does that look like for them? Or what could it look like for them? And if they're in contemplation, what does that stage look like? And if they're in preparation, what does that stage look like as well? And so in the tool, we made up a character, and his name is Juan, and he's 45 years old, and he's an agricultural worker who picks strawberries on the farm and he's been using tobacco ever since he was 16 years old. And he smokes a pack of cigarettes a day. Smoking helps him feel less stress from working long hours and also because he's away from his family. And so he meets a community health worker named Carmen. And so then throughout the stages of change, Carmen is walking through with Juan, and Carmen is sharing tools and resources and kind of giving him strategies on how he can move forward and progress to the next stage of change. And so then Juan is also giving some dialogue and feedback. And so there's this conversational feedback that goes back and forth, and it helps go through each stage of change. Um, Vanessa, can you go to the next slide, please? And so this is the other, it's a couple of pages as you can see, but then it ends with action, maintenance, and termination. And it's just really neat. It ends with, one has been tobacco free for a year and has made many healthy and positive changes in his life, and he feels confident he can stay tobacco free. So it's not only a great tool for agricultural workers, but it's also a great tool for community health workers, for anyone doing outreach there in the health center or in your organization, um, or if you're doing outreach, because it not only is going to give you tips as an outreach worker, but it's also going to allow the individual that you're working with to see what stage of change they're in and how they can progress and move forward to really make that commitment. And we know that quitting is hard. We know that tobacco is very addictive. Um, Research shows that the general person will take up to 7 times to quit tobacco use, but we're here to help them. Just to let them know we're here to continue to provide support, that we can do this together. And again, I just really want to share because this focus group was so crucial to really allowing us to take these next steps to know what resources to develop and what webinars to bring to the community. And so the agricultural workers that were part of the focus group, um, one individual shared that he knows that he knows that tobacco use is not good and it is risky to his health. But he was just like, I'm going to continue to smoke because I get more benefits from smoking than I would from quitting. And so another additional data said that 41% of organizations that were surveyed, they perceived that agricultural workers didn't really perceive smoking as a huge concern. And so for me, as an educator and in the position that I'm in, that's concerning for me because it allows us to know that our work isn't done yet. We need to continue to provide these resources. And I think this tool is going to be great to allow agricultural workers to see that the risks of using tobacco and then moving them from a pre-contemplative state to a state of contemplation, sorry. But with that being said, I think Vanessa, if you can go to the next slide, please. So that does conclude um, our portion of our presentation. Again, my name is Missy Gallegos, and we have our guest speaker was Rosendo
Thank
Iniguez.
you.
So I just wanted to say thank you so much. This concludes the presentation portion of our webinar.